If you've been struggling with the decision on what to do about your missing teeth, I want to reassure you by saying you've come to the right place. Hey there, I'm Dr. Opi Shidende, and I'm a seasoned specialist dentist with years of experience under my belt. In fact, the sole reason I became a specialist dentist was because I treated a patient with a melanogenesis imperfecta when I was in dental school. On completion of her treatment, sustained me through the very difficult days of specialist training. Over the years, I have had the privilege of transforming countless smiles, and today I want to talk to you about the different options for one of the main problems that damages a smile: missing teeth. The options are dental implants, dental bridges, and removable dentures. You may have heard of these options, but how do you decide on which one is right for you? So, let's dive in. Put simply, a dental implant is the closest thing to a like-for-like replacement of your real teeth that we dentists can provide. It is essentially a medical-grade titanium screw that grows into the bone, and a tooth is then attached to the implant with a screw. I know it sounds scary, but they are the strongest and most convenient option available for fixing missing, broken, and in some instances, dead teeth. At London Dental Specialists, we specialize in offering high-quality dental implants to successfully rebuild your smile. But there are other options out there, and in order for you to feel confident about your choices, you should be aware of what they are and how they compare with dental implants. This is why I made this video. So, keep watching to find out more information about how dental implants work and what other options are available. So how do dental implants work? Your specialist dental provider will place a titanium implant into the jawbone beneath the area of the missing tooth. You can then imagine that this screw replaces the root of the missing tooth. After a healing period of about 3 months, a custom molded crown can then be screwed to the top of the titanium implant, thereby fixing it in place. Cosmetically, in fact, no one will even be able to tell that you've got a dental implant. Your dentist will have to consider how much bone you have at the implant site. Some patients might require a bone graft ahead of fitting of the dental implant. A bone graft usually takes bone from the chin, the back of the mouth, and the hip. The bone doesn't always have to come from you these days, interestingly, because the bone used in your graft might come from a patient who has had hip replacement surgery. During hip replacement surgery, the head of the femur, which is the long bone, is removed so that the new hip can be placed, and this bone is donated to dentists to be used in bone grafts. Of course, this will always be clearly communicated to you during treatment. Whilst a bone graft is beneficial, if one cannot be done for whatever reason, or one you've had previously is no longer working, a much longer dental implant can be screwed into the cheekbones, right underneath the nose, or right behind the upper jaw. These are beyond the scope of this video, so look out for future videos for more information about these special types of implants. So what are the alternatives to dental implants? It's important to stress that what is right for someone else might not be right for you. There are 2 main options for replacing missing teeth outside dental implant, namely fixed bridges or removable dentures. The fitting of a traditional fixed type of bridge involves drilling a tooth down to a stump, taking an impression of that stump so that a dental technician can then fabricate a bridge that goes across the missing teeth. Whilst this is more secure than other forms of dental bridge and as successful as a dental implant, the destruction of the natural tooth could lead to the need for root canal treatments. This is where we enter what we call the restorative spiral. In other words, the more a tooth is restored and repaired, the more damaged it becomes until eventually the tooth is so severely weakened it can fracture during normal function. Another common type of bridge is a Maryland bridge. also known as a resin-retained or sticky bridge. This is where a replacement tooth is just glued into a gap and fixed in place by a wing-like structure on the neighboring teeth. Dental bridges can last for very many years, especially with good oral hygiene and dietary practices. However, it is important to be aware that it isn't uncommon for the cement to deteriorate or for patients to fall short of good oral hygiene, leading to tooth decay and eventual collapse of the bridge. One of the great advantages of dental implants is that restorative spiral just does not happen. And the more missing teeth you have, the more important it is to choose a treatment option that is strong and doesn't cause further damage. Now let's talk about removable dentures. The most important consideration here is that they require much more extensive hygienic care to keep them healthy. Quite simply, it's because dentures trap plaque. A clinical trial conducted in Newcastle University whilst I was there compared patients who had fixed teeth with those who had removable teeth. This study found that patients with removable teeth had higher rates of gum disease and dental decay. Other studies around the world have also supported this finding as well. This is not to say patients who have dentures are doomed. Of course not. However, if you choose to have a denture, your oral hygiene must be pristine in order to keep your teeth. It is much harder to keep dentures clean than a dental implant because dentures must cover many teeth, leading to a buildup of much more plaque compared with a dental implant. For reasons we discussed, namely reduction of decay and gum disease, no risk of root canal treatments, and quite frankly, strength, dental implants are my recommended option when possible. It is important to stress that dental implants are the most advantageous option for fixing missing teeth, because once the implant is locked in bone, it is, unsurprisingly, much stronger than any dental glue and therefore able to take much more force. In fact, the only patients for whom a dental implant might not be appropriate are those who have had radiotherapy in the area of the mouth that requires the implants. For example, some patients with salivary gland tumors require radiotherapy which hits the bone. The radiotherapy will kill the blood supply to the bone, and in those situations, a dental implant is not ideal at all. Whatever your situation or issue, I want to equip you with the knowledge you need to feel confident and reassured even before you visit London dental specialists. If this video has been useful, please do me a favor and hit the like button below. If you also subscribe to our channel, you'll be notified as soon as we share our videos about other types of special dental implants. Please also feel free to make comments below about the things you want to learn, and I will be sure to make those videos in due course. Thank you so very much for making it to the end of this video. I suspect you did so because you want a solution to a cosmetic problem. Please do not suffer in silence. The patients on the screen have all had successful implant treatment with me and have all said they wish they came years earlier. Finding solutions for you is the sole reason why my team and I are excited to work every day. You deserve to be able to speak and smile with confidence. If a cosmetic problem bothers you, there is a solution. So please fill in the form below and one of the team will contact you very soon. See you in the next video.